Good afternoon, doctors. Nice to meet you. It's my great honor to present live surgery in front of distinguished doctors. Today, I want to perform live surgery in a patient who missed the maxilla. And I will use the casket and the lasket, which is the sstem's nice instrument to perform sinus sponge graft. Okay, I'll present the case of the live surgery case. Here is a 62 years old female patient who is generally healthy. And she is in partially dentaless condition. And in this panorama radiograph, we can see that both maxillary posterior teeth are missed, and the remaining bone height is not so sufficient. Right side, the remaining bone height looks 1 to 2 millimeter. Left side, about 2 to 7 millimeter. So this case, to place the implant, we need to graft some sinus, inside the sinus, we must graft something. And in this CT view, look at the remaining bone height, very limited. Today, Dr. John and me will perform live surgery, one side and one side. Right side, Dr. John will perform the sinus graft, and the left side, I'll perform another sinus graft. This is my case. Okay, I'll perform sinus graft at the left side. Look at the remaining bone height at numbers. First molar site. The remaining bone height looks just 2 millimeter. Maybe this is the indication of the lateral window for sinus bone graft. But in this patient, look at the position of the interosseous artery. It looks very lowly positioned, just here. So in this situation, if we open the lateral window, there is an increased risk of arterial bleeding. I can manage, but this case, I decided to use the casket first. Through the crestal approach, I can lift the membrane using the casket. Then, maybe with the membrane, the artery can be elevated, so we can reduce the risk of arterial bleeding. And then, actually, I can perform just a crestal approach, but I want to show what happens after the hard lifting membrane separation. After the casket, I'll open the lateral window, and then I'll show you what happens. And next, I'll grab the bone and we'll place 3 implants. Okay, this is my plan. After finish my operation, Dr. John will continue the right side. Okay, this is Dr. John's side. In CT view, the central inside is mobile, so it will be extracted. And the alveolar width looks just borderline. Can place implant without special management, but this is borderline. Depending on situation, Dr. John will perform another special management. Look at the right maxillary sinus. The remaining bone height looks just 1 millimeter. It's really limited situation. And the width of sinus looks very wider. This is a very difficult situation. And the thickness of the lateral wall looks relatively thick. Anyway, in this side, Dr. John will perform the sinus graft using the lasket. Okay, first he will extract the central incisors and then place implant. Then using the lasket, he will open the lateral windows, and then after the graft,